Okay, we are ready to start. So, welcome everybody. I am Dr. Jen. I'm here with Katie, who has been on our show, Eat Your Damn Food. This is not her first time with us. So, Katie, welcome.
Thank you for having me. I'm so happy I can continue to support FAB with my content and with being on these live videos.
Yeah, and it's such a pleasure to have these conversations with you, Katie. I mean, gosh, how far you have come since, I
Yes.
mean, how many years now? Now we're on, is it two?
Yeah, actually, it's July 2nd right now. So it was 2 years ago in July that I graduated FAB, and 3 years ago in July that I started the program.
Oh, wow. Wow. Okay. And what a perfect way to celebrate like 4th of July coming up, which is all about freedom and being free from your eating disorder. So it seems like the perfect time to be doing this. And we're going to be talking about something really important that I think we're hearing about more and more, which is somebody who's dealing with an eating disorder, eating struggles, is sometimes we call it, and being on the spectrum. So being on the autism spectrum. And Katie, I know for you, when I first met you, I remember how open you were about saying, introducing yourself and saying, "Hi, I'm Katie, and I deal with Asperger's." And so I know you don't exactly introduce yourself like that anymore, but back then you were very open about that.
Yes, I was pretty open about that because I think during the time my parents were telling me that maybe it'd be best if I tell professionals that I do have, in fact, a condition on the autism spectrum called Asperger's. And if people ever saw me talking in a certain way or acting in a certain way, it'd be good for them to know I had Asperger's so they would know it's because of that.
Hmm. And maybe we could even back up even before the eating disorder. And do you remember when you were actually given that diagnosis and what was going on that your family decided, okay, we're going to get her tested, we're going to find out what's going on for her?
Yes, I think this all started in like third grade when I was like 8 to 9 years old because that year was pretty tough for me because I was struggling a lot academically and I had to stay after school a lot and do my homework with a intervention teacher, and that's when my parents decided maybe we should get her tested. And when I was like 9 or 10 years old, I was tested. I can't remember by who, but they determined that I have Asperger's, which is a case on the autism spectrum. But they said it was just a mild case, but I needed certain professionals to help me learn better. So my parents started looking for a different school for me that's specialized with people with this condition. And sure enough, they found a good school out in Webster Groves of Missouri. And I was at that school from fourth grade to eighth grade, and I actually really enjoyed it. So I started liking school again because up until then, teachers restricted me. They didn't know how to teach me because of my Asperger's, and I really hated school. But at this new school, they were patient with me. They knew how to treat me. They learned how to teach me and give me like what I needed. So I really liked the school more. And this is when the first time in my life I actually made friends by myself.
Oh, wow. This is great hearing this part of your story, Katie. And
Mm-hmm.
the other thing that is bringing to mind hearing this is how important it is to make sure you're working with people who really get what you're going through. Because
Yes.
you're saying you maybe had good teachers at the schools you were going to, and growing up in Missouri, but they didn't understand your learning needs, maybe your social needs, your emotional needs. And so, how important it's something we always stress with eating disorder treatment, right? Is like
Yeah.
making sure you're working with the doctors, the therapists, the nutritionists to really get what it's like to deal with these, food and body struggles. So, if we fast forward a little bit, by the time then you came to us, you were really kind of in the thick of your eating disorder that manifested both as restricting and then very much so as overexercising.
Yeah. That was pretty tough, and yeah.
Yeah. And Katie, I know you've said to me before that you really see how I'm going to say Asperger's, because that's the name that you use, really kind of set you up in some way for the eating disorder, right? Like you've said that to me more than once. And can you explain to anybody listening today, there may be professionals or families that really want to understand, like, well, what it why? Like, why did that set you up for these then more extreme behaviors around your food and your body and your exercise that were pretty rigid?
Yes, and going off what you just said, the word rigid, that really ties into like people with autism and people with Asperger's, because people with Asperger's are pretty rigid, and they like a routine, and they do not like being disrupted of their routine or things they have planned. And I think around my food, once I made these like rigid decisions or routines around food and exercise, it was really hard to break them, and it was hard to like believe other people like a different or well just different thoughts about food and exercise too.
Mm. So it sort of started off as like, hey, I'm trying to get healthier, which is a phrase we hear from a lot of our clients, right? Like it starts off as my intention with this, or at least my intention kind of that I am very aware of, starts off as like, hey, I'm trying to get healthier. And what you're sort of saying is like some of this rigidity and these rules, it went from something that maybe had a good underpinning of health, then at some point it went way too extreme in terms of the food and in terms of the movement. And one thing I do remember when you started with us is you were very attached to that little app of yours. Like we couldn't almost pry it from your hands. Like it took something, right? I mean, but that's how recovery works. Like we don't just drop our behaviors all at once. But yeah, what do you want to say about like that rigidity? Like you said, I had these rules and I wasn't going to deviate then from these things I had put in place for myself, and that app was a piece of it.
Yeah, I'm not going to say the name of that app, but my father actually put me on that app to see if I can actually get healthier or put some weight back on, because I was pretty underweight at the time. But that had the opposite effect.
Mm,
That app kind of backfired on me because I believed everything it said, and I just took everything to the extreme on that app. If it said if you eat like this for so many days, you'll weigh X for that, and
mm,
that's not entirely true, because everybody is different and performs different, and the app doesn't know like what's going on in my body. It doesn't know my body percentage or anything like that. And because of that, and I read like what it told me, I believed that and took everything it said to the extreme.
wow. So the thing is that, many of the clients that we work with who have an eating disorder all are already kind of very black and white thinkers in general. Like we're painting with sort of like a general paintbrush here. But then, sort of what you're saying, Katie, is for you, and maybe other people can relate to this who are on the spectrum, are very black and white, kind of have these like rules, and gray is hard to distinguish. So, in some ways, what I'm hearing, it's like you kind of had the double whammy, both with dealing with Asperger's and then dealing with this eating disorder that really had kind of the rigidity, right? And I'm trying to think about how eventually you did get off that app, but it took something. Like it definitely took something. Do you remember what finally had you, okay, I'm going to give it up?
Well, I think like the giving up the app probably happened after, well, I had my big turnaround in September of 2022, when I had an appointment with my medical doctor, and she said I can either stay with FAB and do everything they tell me to do, or go into a rehab center. And I did
Mm,
not want to go into a rehab center, because then I would be more restricted to like what they tell me to do than I would like when I was with FAB. So I decided to put 2 feet into recovery and stayed with FAB.
mm,
And after that, so that's when I had to give up the app completely because the Fab told me to do that. And like being off the app was really hard, and I couldn't see like the gray area and like, eating without an app. All I could see was the black and white. So what I had to do was practice like, what works best for my body with when it comes to eating and movement, and just learn from trial and error.
Mm. It's bringing back some memories, Katie, right? Like, for me, because I can remember, and look, this isn't uncommon when we're working with somebody who's struggling, right? There's a reason that we have in FAB our 5 stages, because we know it's like people don't just drop these behaviors because they've been doing them for a period of time. And it can really feel almost like, your security blanket. So, there were other things we were asking you to let go of, right? We were starting to ask you to let go of weighing yourself. I remember that one. And that was a little bit of a power struggle. We were asking you, okay, we're going to ask you to start limiting the exercise and even pausing for a period of time. I know that was a big thing when I think it was Morgan, the body image therapist on our team, was like challenging you. What would it be like, Katie, to see what it's like to take a pause and notice what comes up? So there were a lot of things we were asking you to do differently. And, sometimes there was a struggle with it at first, but you eventually would lean in. Sometimes you would scream first and then you would lean in, right?
Yes, definitely. Like
Oh,
I think my first answer to something new or to change or something I'm frustrated with is always no. But then after a little while, when you think about it, you say, "All right, I'll come back around and I'll say yes. Let's do this. I'm willing to give it a shot."
yeah. And I know we're sort of laughing about this now years later, but I wasn't joking when I said there were some times like you would be that angry, right?
It was no laughing matter.
It wasn't then. Now you can look back and be like, okay, I can see it differently now. So people that might be listening to this, whether that they find themselves on the spectrum or not, or dealing with an eating disorder or not, how did you start practicing the gray when you already kind of had the double whammy? Because you really did practice that with us. Because, right, the FAB program isn't good foods, bad foods. We're all about trying to find balance. We know no two people kind of deal with these problems with their food the exact same way. So there's not like, again, a rigid plan we give to people. So how did you start practicing some of finding that middle?
So I think like after my turnaround, like I said, I just had to like do what Fab told me to do and just practice it and just do trial and error to see what worked for me and what not worked for me. And yeah, I was pretty scared about it first because having Asperger's, you're kind of afraid to like, fall or fail. You can be kind of a perfectionist, but with something like this, what drove me to like look for the gray area is my desire to be completely recovered. So since I wanted to be recovered, I had to like, practice this gray area. And it did take some time and a lot of practice, a lot of falls and a lot of standing back up, but eventually I did reach that point where I could see more of the gray area.
Mm. I'm remembering something too. So I'm glad all of these memories about your journey with us are coming back. And one of the things I do remember is how much when you had your turnaround, right, was like, okay, I want to do this outpatient if I can. I really don't want to go into, you call it a rehab center, like a treatment center. And look, sometimes those are really beneficial, right? Sometimes people do need that level, but you felt like, hey, if I really put 2 feet in and give this a shot, maybe I can do this outpatient, right? And what I remember, Katie, at that point is when you started utilizing the whole team,
Yeah.
even in between like our sessions, between the sessions with Dr. Yvonne, the nutritionist, between group sessions, if anything came up, you'd be reaching out. You'd be asking for help. You would be saying, hey, give me guidance here. Give me a tip. Give me a tool. I need something, right? You
Yeah.
were excellent at asking for help at some point. It didn't happen the first couple months, first handful of months.
Yes, I mean, what caused me to reach out to the team was my desire to be like completely recovered because I didn't want to live like that anymore, and I knew that the team had all the information, all the advice I needed to recover. So I had to reach out to them whenever I felt triggered or I was struggling, and I had to be very detailed with them on like what was going on because that would allow them to see how I was struggling and how they were able to help me.
Mm. And you know what? I think that part maybe could be your personality. Maybe some of it is you being on the spectrum, but you were so detailed in your messages, like so specific that we really felt like we had a snapshot of what was going on, how you were struggling, and that allowed us to even help you more.
Hmm.
I
Yeah,
don't know if you're aware of that because most people don't always put all those details like you did, but I found that really helpful with you.
yeah, I do think that people on the spectrum sometimes they can be very detailed in like how they talk or how they write because whenever I'm writing a paper or so, I can be very detailed. Like I think I can get more of my mind out on paper than I can through my own talking.
Mm. Well, I want to say something else, how we knew things were really starting to change for you. There was a point where you would still send many of us on the team, it would be the same message because you knew like one of us was going to be like available and could respond, and then you would get other responses like as the day went on. And I remember at some point you would say what the struggle was, and then you would say what you were going to do. Like, okay, here's what I could actually do to help myself. I don't know if you remember that, but there was then, you didn't need as much feedback from us because you're like, I know what to do in this situation.
Yeah, I think that's when I was further along in recovery, and I remembered what the team had originally told me, and I was going to practice on like what they told me to do, and I was going to tell them that that's what I was going to do.
Mhm. And that again, I can hear a little bit of when you were with us following kind of the guidelines and the map we were putting out. Like you were somebody, if we're like, hey, Katie, we'd like you to work on the FAB curriculum in between your individual and group sessions. Who finished our whole curriculum with us? You
Yeah,
did.
I finished. Yes.
Yeah, you did, and you followed it according to like every week. I mean,
Mhm.
maybe there was a week you missed and you'd be like, I missed my week, I'm gonna get back on, but you really did the program. Like you really, like you said, you put 2 feet in. I mean, you put 2 feet in, 2 fists in, and I think that's why you also are where you are today, Katie. So I want to ask you one more thing about your support because I do think sometimes we learn what ways we need support, sometimes from what doesn't work. Um, but I do remember how instrumental, at least during the time you were with us, your mom was.
Mhm.
Like she became really like a partner with us as part of the team, part of your team to support you, even to the point when you were living in Florida. She came down here for a period of time and she would come to your sessions and she would sort of just be there. Like she didn't, I don't know, she didn't like micromanage the session. She was just like this calm presence, and she was really great at sort of taking some of the guidance and then I think being able to support you with that, outside of the session, in your meals, in your life. So I'm wondering if you could say how your mom's help helped you, because I think other families really benefit from hearing some of that.
Yeah, so I really liked how my mom came down and helped me and was also listening in on my sessions because she wanted to learn like from the teen like how she could best support me throughout my journey. And if she had not come down to live with me to be a support to me or to eat with me or to teach me, then I don't think I would be where I'm at right now. And she was just so patient with me too. And this that kind of patience and that kind of encouragement and sometimes that tough love is something that I really needed in order to recover.
Yeah. Okay. So patience was helpful. Her being, I remember your mom being very gentle, like with
Mhm.
sometimes her feedback, like, but you also said sometimes she had to be tough with you because I remember there was a phrase you used to use, Katie. You would get into thought loops. Those were your words. I'm kind of like in this thought loop and I can't get out of it. I
Like,
think that sometimes when you relied on your mom to help you break those like loops.
yeah, so like those loops you're talking about, that's called cycling. Like sometimes I was cycling on like the bad thought or the worry, and my mom would point out to me, Katie, you're cycling. What can
Mm,
we do like to break that cycle? So bringing that to my attention that I'm cycling, I tried to look for a way like to break that cycle and something that I could do like to calm myself down.
mm, so good. So I'm hearing, right, like having loved ones involved, right, like learning more about the process, like your mom really did. Also being patient, maybe knowing when to be patient and then sometimes when to be like, hey, like you're like you said, Katie, like you're cycling. That was helpful for you. But she also had the gentle, the compassionate, the patient. So she really struck a really good balance.
Yeah, she definitely did.
Yeah. Yeah. So, Katie, anything else you would want families to hear that maybe have a loved one with an eating disorder, maybe an eating disorder and their loved ones on the spectrum? Is there any other advice you might give to family members who are trying to support their loved one, just like your mom was on the journey with us?
Well, probably just to like be patient with their loved ones who are struggling, and also listen to all their struggles, and try to be there on their sessions and learn like how they can best support them, and sometimes to give them tough love, like when they think that their loved ones need it, because you can't always give in to like their bad thoughts or their constant complaining or cycling, because it's important that they break that cycle.
Mm. And something you always say, Katie, is recovery is not a straight line,
Mm.
right? It's just not. I mean, look how many twists and turns that you had to go through to get to this point.
No, I like to say that recovery is not linear. And my medical doctor at the time has said recovery is like climbing Mount Everest, where you take like maybe 3 steps up the mountain, but then you got to take a step back and then take some more steps up, a few steps back, all the way up until you reach the top.
Hmm. So beautiful. I think that's a great note to end on at the summit, Katie. And, as soon as we climb that mountain, we realize, wow, there's other mountains in our life we get to climb. And I know you're really creating that beautiful, joyful, fulfilling life, Katie. So thank you so much for being here and sharing so honestly. And I think what you have to offer, Katie, just makes such a difference for people. It
Yeah,
really,
thank you. So
yeah.
happy I can be here.
Yeah. Okay.